slow the spread of the disease, but unable to prevent it completely.
Well, the Chinese government, Chinese officials did announce at the end of last year that they were investigating a novel coronavirus. What we know now is that there were cases from early December, which means patients were potentially symptomatic back in November. As the weeks continued, there were more and more evidence that medical staff had been infected, which is one of the first hints that human-to-human transmission is possible. But again, China didn't announce this until late January. So there was potentially much more that the officials here were aware of, but for whatever reason didn't make that very clear to the public until later on.
By the time we knew about it, or by the time even the central Chinese government knew about it, this was not going to be contained in China. And the fact that China was able to get the epidemic under control, at least temporarily, speaks to just the unique level of control that the government can have. And I think that what we're seeing now in Europe and the States is the fact that in those kinds of societies, that level of control is just not possible.
Total containment of a rapidly spreading infection could only be achieved through total isolation or quarantine. Without that unlikely measure in place, our best opportunity for success remains international cooperation and transparency on global health matters.
I don't think that closing borders was going to ever stop this virus. And if you look at what happened of the travel bans that were initiated when this outbreak was announced, they had no real effect, I could say, no measurable effect. And it also takes public health resources to enforce those travel bans. You have people doing things at airports, you have people quarantined that come back from those places. All of that takes away precious public health resources that really should have been devoted to case finding and diagnostic testing and hospital preparedness.
Viral spread flourishes in the wake of human error. Political candour and transparency, global cooperation, strong regional health systems, and scientific research remain our most valuable assets in the war against the spread of a new infectious disease. Malfeasance in animal farming leading to disease is by no means a China-only problem, as exemplified by the outbreak of mad cow disease or bovine spongiform encephalopathy. Mankind has a long history of zoonotic diseases, from anthrax to listeria and Ebola to HIV. Both animal husbandry and wild animal interactions have carried risks from across the world. Fostering an international compliance on all farming and wildlife practices that mitigate the spread of new disease could prove to be a Herculean task. Politically, the diplomatic hurdles set by the coronavirus crisis will be a great test for the international community and could be a factor that determines if and not when we see another disease outbreak like COVID-19.
What I want to see is this abandonment of this panic and neglect cycle where there's panic to get something under control, and then when something recedes from headlines, it then becomes a cycle of neglect. We saw that after H1N1, we saw that after Ebola, we've seen that after Middle East respiratory syndrome, we've seen it after Zika virus. That happens over and over again.
It's very difficult to say what will happen after this outbreak or this pandemic is finally contained or mitigated in such a way that people can get back to a semblance of normal life. And this will certainly have an impact on how we move forward. And hopefully the political memory of this pandemic will be longer than was the memory for the SARS outbreak.
To be able to deal with this, we need to work together. We can't work against each other. Pulling up the fences is not going to keep it out. So it needs global risk governance. And I think it needs global One Health risk governance. And obviously, national governments don't like that, okay? Because it means it takes power away from them. But I would hope that they all realize by now that they're helpless. They can't stop it. And I just wonder whether this shock at the moment is actually strong enough to convince